All right. We're going to go on to topic Tuesday. And so I think this was still written by Adam, our third year med student. So
Hold on.
hoping that you're
And you are
staying.
going to read every one of the beautiful words he writes. No live editorializing because you feel like he's being too friendly. It starts
Oh,
with
no.
"What's up, family?" exclamation point.
All right. Quote, what's up, family? How's that? All right. Adam hopes you are all doing well and staying warm during this cold surge over the country, which I felt like it went away for a couple days and then it came right back. But be sure to bundle up. Get yourself a nice hot cocoa and spend some time with your loved ones whenever you can. It's good for the soul, so it must be good for the heart. So if you were with us last year, then you know that we reviewed a bit of anatomy, aortic anatomy and zones, which we did. We talked about a lot of different zones, and it's actually in Aortic Dissection, the patient guide. So let's bring back our weekly quizzes that we put in place here. Without peeking, let's see if you remember this. Which zone, there's 8 of them, 1 through 8, of the aorta contains the renal arteries? Let me think about this. I'm gonna guess 6. What do you guess?
I want to say that there was 7.
You
Oh, no,
think
no,
it's
wait, wait,
7?
wait. No, 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 wait. I heard the question wrong. So, which
I
zone
thought
contain the renal arteries? 8.
you think it's 8?
It's got to be.
No,
I
because I
don't
think
know.
the
What
8
would I
goes
know?
no. I think 8 goes into the iliac, but we'll find out. Hopefully he gives us the answer because I don't remember right now. But for this week's post,
No, no, no. Yeah, I think you're right.
I wanted to talk a little bit about something I do not believe we ever touched about before, and we had not, and that's called myocarditis. Okay. Maybe some of you have heard about it, but there is a link that Adam included from the Mayo Clinic, which has so much great information about myocarditis. But let's talk about this. So, a myocarditis, I believe, is another fancy word for a heart attack. So, this is your heart muscle. This is what it looks like. Here's a cross section. Bonk. Close up, this is what your heart muscle or myocardium looks like up close. And this is a myote, a heart cell. Myocarditis is inflamed heart muscle. Okay, I'm still could be right. I'm still waiting, but it's an inflamed heart muscle. Here's damaged myocyte or heart cell, and here's inflammatory immune cells. Let's review some of the anatomy to paint a clear picture. Okay, so you have the heart. The outer layer is called the pericardium, and it consists of 2 thin fibrous protective layer that contains fluid to protect them from friction, so they're not rubbing against each other, these 2 layers. And then you have a layer inside. You see that orange layer? That's the myocardium. It is the middle layer that contains the heart muscle. And then deep inside is the innermost layer. That's the endocardium, and it actually lines the inside of the heart. So the heart consists of these 3 layers that we just talked about. Pericardium, again, is the fibrous covering of the heart that helps protect the heart. The myocardium is the middle layer, which consists of a majority of the heart's dense muscle tissue, and the endocardium is the most internal layer of the heart that lines it. And so myocarditis refers to an inflammation of the myocardium or middle muscular layer of the heart with symptoms that includes fever, chest pain, shortness of breath, and palpitations. So I'm thinking I was probably wrong. Sounds like it's an infection, right? Or inflammation. Additionally, because much of the heart's contractile or pumping function depends on the myocardial layer, severe myocarditis can cause heart failure-like symptoms, including swelling of the lower extremities and difficulty breathing when you lie flat due to fluid in the lungs. There's several potential causes of myocarditis, including an infection, could be viral or bacterial, certain medications that your body is just too sensitive to, such as certain antibiotics, can cause myocarditis, chemicals such as radiation or carbon dioxide, and inflammatory diseases such as lupus or arteritis. Butchering a word, but arteritis sounds about right. All right, so when you're experiencing myocarditis, it can be incredibly stressful experience because most cases often resolve on their own without any persisting side effects or cardiac damage. But severe cases could lead to a persisting heart failure or permanent damage to the heart and its conduction system. So here's an example. We have normal heart muscle, normal myocardium. I don't know why, like I feel like my mouth is full of marbles, and normal myocardium heart muscle. Here's when it becomes inflamed. So you've got these inflammatory immune cells in here attacking your normal heart muscle, and it becomes inflamed. Look at that. Look how big and thick. It's thick and it's swollen, and it impacts the heart muscle when you have myocarditis. So to help protect yourself against the risk of myocarditis, it's good to practice to avoid activities that can get you sick. So wearing a mask will help you not get sick. Avoiding close contact with people who have cold-like symptoms or other infections. If you're sick, be sure to do the right thing and avoid exposing others too, because you could create myocarditis in them. So wash your hands regularly and avoid risky behaviors that can get you sick, such as unprotected sexual activity and the use of non-prescription drugs. If you or a loved one ever had a severe reaction or allergy to a medication, be sure to let your healthcare provider know if you're being prescribed any medications. So again, if you've ever had a severe reaction to medication, it's important to let your physicians know, because as we heard above, certain antibiotics and medications can cause myocarditis. So additionally, stay up to date on your recommended vaccines, including flu, rubella, COVID-19 viruses, all which can cause myocarditis. And that's it for this week. Be sure to take care of yourselves and your loved ones. Until next time, let's remember to think aorta. With warmest regards from Adam.
He does such a great job.
Myocarditis. Blah, 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 blah. I feel like I need to relax my mouth from saying myocarditis too many times.